Good morning. Welcome again to another edition of Facebook Live here at Ochsner, where we're going to be talking to you about COVID-19 and some of the latest developments. It's November 5th. We actually have had a wonderful week here, and we have got some wonderful news to share with you today. I'm Dr. Robert Hart, the Executive Vice President and Chief Medical Officer at Ochsner Health, and I have several guests with me today that are here to answer questions for you and bring you the latest information that we have about COVID-19. So we have Dr. Sandy Kimmerly next to me here. She's our System Medical Director of Hospital Quality. We have Dr. James Wayne, a pediatrician from Baton Rouge. He is the section head of Ochsner Health at O'Neill. And then we also have Dr. Kathy Baumgardt, Medical Director of Infection Control and Prevention. So they are our experts, and I'm sure Dr. Wayne probably may be the most excited as a pediatrician with some of the good news that we're going to share with you today. It's going to really change your practice and the things that you are able to offer your children. So looking forward to some of the questions around that. The Food and Drug Administration just this week has expanded the emergency use authorization of Pfizer's COVID-19 vaccine to include children 5 to 11 years old. So this is in addition to what we had had previously, going up to 12 on up, but now 5 to 11 are able to get it. The results of Pfizer's trial really showed a very robust immune response in those children, and obviously found it to be very safe. A lot of safeguards, a lot of studies were done to get to the result where we are today, so very happy with that. The reason this is important is we all know, we talked about this before, the increase in the pediatric cases that we saw in that fourth surge with the Delta variant was quite significant. Really had not seen anything like that with the other three surges. So it really did take its toll in that age group. So this really gives us some extra protection. So with the FDA approving it, now the CDC, and even here within our state, the LDH approving it, we're going to be able to start offering that here. Now today we're going to be answering a lot of your questions. We've had some questions that have come up just as we've begun to discuss this and as it's become more apparent, kind of leading up to this, that we were going to be having this opportunity to vaccinate this group. But before I get started with some questions for the group, I want to give you all some statistics that we've tried to update you on every time we've met. Here in Louisiana now, we've had over 761,000 cases of COVID-19. We've had 14,500 deaths just within our state. Now the great news is we are vaccinated at 47.68%. That's not quite 50%, so we still have work to do. But I want to give you a little bit of example of some of the differential that we see across the state. If you look at New Orleans and Jefferson Parish, we're over 60% vaccinated in those parishes. Baton Rouge is sitting at almost 53% vaccinated, and then Lafayette is still under 50% at almost 49%. So we still have a ways to go. The exciting thing about this new approval is that it allows us to get more children vaccinated, which should raise that rate, that vaccination rate in the state. Within the U.S., we've had over 46 million cases, and that has included now 751,000 deaths across the country. Really, it's surprisingly high total, and really a sad total that it's been that high. We are vaccinated now at over 58% across the country. So I say that because if you look at our state, we're still about 10% behind the rest of the country. So we still have some progress to be made there. But with this new approval, hopefully that'll drive some more people to get their children vaccinated, and hopefully the parents, grandparents as well, of those that may be hesitant. So we want to get into this and answer some questions about this. So why don't we go ahead and start with that information. Let's go ahead and start with Dr. Baumgardt. I have a question for you today. Why don't you just take us through who currently can get the vaccine and what vaccines are available to them, because different ones are available at different ages. So walk us through that.
Sure. So let's start off with the adults. That's who has been able to be vaccinated for the longest. And so for adults ages 18 and above, we know that there are 3 different preparations still. That has not changed from the new information we have about kids. So we still have the Pfizer vaccine, the Moderna vaccine, and the J&J vaccine. And remember, for the Pfizer and Moderna, that's the 2-dose series to be fully vaccinated, and then for the J&J, it's the 1 dose. And then there was new news about the boosters, which has been apparent over the past few weeks. Now, the exciting news that's come up this week is that the FDA, the CDC, and the special subcommittee of the CDC, which is called the ACIP, and also the Louisiana Department of Health have now approved, under emergency use authorization, vaccination by the Pfizer vaccine only for ages 5 to 11. And then also we had information before from ages 12 to 17. So what that means is the Pfizer vaccine is now available from ages 5 up. And that is a 2-dose series still in children, just like it is in adults. The Pfizer vaccine for children is a 2-dose series. Now, there is a little bit of difference in the emergency use authorization for kids ages 5 to 11. The difference is the dose is a little bit smaller. The studies that they did were in a dose that was 1/3 of the dose that we use in adults. And they found that that was very effective at providing protection for kids and very safe. So that is the only difference in that vaccine for that small age group of 5 to 11 years old. The other thing that we know is that we can give that at 0 and 21 days, just like it's given to adults. It's still a 2-dose series for that ages from 5 to 11.
Great, thank you. So why don't we, let's turn to Dr. Kimberly and say, why are we encouraging children to get the vaccine? And now with the new authorization going down to a lower age group. So why is it important?
Well, it's important not only for the children, but the people they interact with. And we do know, although COVID has affected millions of children around the world, generally speaking, it causes less severe disease in children than adults, but it still causes significant disease. And unfortunately, there have been hundreds of deaths in children associated with COVID. So it's not a simple runny nose in some children. They can die. And also, children, as anybody, can transmit COVID when they're asymptomatic. And so it's important for the people that the children are around, such as their parents, grandparents, teachers, maybe other immunosuppressed children, to be protected so they don't inadvertently spread COVID around. So again, we have this vaccine now that's available for children as young as 5. And so we're very encouraged and very excited to get more people vaccinated.
Great, great. So Dr. Wayne, you're going to soon be able to give these vaccines in your office, so excited about that. But can you tell us, Dr. Baumgardt did a nice job of taking us through several different vaccines. We know there's 3 that are available in adults. Why is Pfizer the only one so far with the EUA in this younger age group?
And thank you for that question. So the emergency use authorization is granted based on age groups. So as you all know, earlier this year, Pfizer got approval after their clinical trials for ages 12 through 17. Their results from that clinical trial showed nearly 100% efficacy in generating a robust immune response, immune antibody response to the vaccine. So it was approved for that age group first. More recently, they've completed clinical trials for age group 5 through 11. And with those studies, it showed nearly 91% efficacy in creating a robust immune response. So the Pfizer vaccine is the only one that thus far has completed those clinical trials for age group 5 through 11. And we're excited about that. The trials are ongoing for children actually 6 months and up now. So we are hoping in the not too distant future to have emergency use authorization for this vaccine down to age 6 months.
So stay tuned. We may have some more exciting news in the future about that.
Absolutely.
So let's go back, Dr. Baumgardt. You kind of hit on this a little bit earlier, but tell me specifically some of the differences with this vaccine for the 5 to 11-year-old age group than what the other vaccine that we had been using in the older groups.
Sure.
So tell us about that.
Sure. So in this age group, because they're younger children, they're smaller, there was differences in terms of the dose. And that's really the only difference is the dose that we use. Because children are smaller than adults, smaller than that 12 to 17 age group. The dose that they found during the trials that worked effectively and best and safely for kids was 1/3 of the dose that we use in adults. Again, it's still a 2-part series, so you still get a vaccine at day 0 and then day 21, but it's 1/3 of the dose. That is the only difference. The preparation is still the same, the ingredients are still the same, so the dose is the only thing that's a little bit different, which is great because we know that in adults and in the population in general, this vaccine has been given millions and billions of times across the world. So we have that confidence that this preparation is safe and effective.
Great. And it's not uncommon, I can add that in childhood, some of the immunizations that we use in childhood, we do use several shots in a series, 2, 4, 6 months in certain shots. So it's not unusual to have a series of doses for vaccines.
I always forget you have that pediatric background too.
That's
but
right.
Yes,
Fellow
you do.
pediatrician.
You
Have
are
to break that out
technically-
every once in a while.
Yes, you do. But
Great.
I mean, and that's in line with other vaccines that we give in childhood, right? I mean, we give flu vaccine to kids. We give mumps, measles, rubella. They're the same formulations that we give in adults, but the doses may be a little bit different depending on the child, the weight of the child, the age of the child, that sort of thing. Same thing here.
Great.
Yep.
So, Dr. Wayne, we used to get this question a lot when we were talking about the vaccine in adults. Maybe someone has had COVID. Question is, do they get the vaccine or not? What's the response on that?
Absolutely. I think that children, even if they have already been exposed and fought off COVID-19, they absolutely should still get the vaccine. There's not enough data right now to show how long the antibodies will last after you've had a COVID-19 infection. So we're not sure exactly how long those antibodies last. Getting the vaccine adds another layer of protection. So in addition to our social distancing, wearing masks, hand washing, getting the vaccine just gives another layer of protection. Even if you've been exposed to the virus before, having the vaccine is going to help your antibody count to be a little bit higher and have you better prepared to fight off the virus if exposed.
Great. Okay. So similar guidance. Let's get that vaccine. Had a question come in here about side effects. So this is a great time. Maybe Dr. Kimberly, you could take this. What are we seeing? What did the studies show us about the side effects in this age group versus what some of the studies had shown in the other age profiles with the vaccine?
Yeah, it's encouraging. The side effect profile is really the same in children, teenagers, and adults. Commonly causes soreness at the arm at the injection site, may cause fatigue or fever, some muscle aches, but generally speaking, these vaccines are very, very well tolerated. And there may be a little drowsiness or sleepiness for a few hours or a day or so, but all are self-limited and go away within about a day.
Okay, great. And we know that in vaccines, certainly arm soreness, a little low-grade fever. I would say Dr. Wayne probably gets a lot of those phone calls after giving other immunizations
Absolutely.
with those kind of concerns. So
Sure, it's our immune system working properly and doing its job. So with any vaccines, those side effects can occur.
great. Okay. Now, one of the things that we've heard about the vaccine is this potential side effect of myocarditis. So maybe, Dr. Baumgardt, could you explain that to us, what the concerns are, what we know about it, because that's a question that I've gotten a lot, even in the adult population, is what does that mean for us? And certainly from parents, that's going to be a concern they have. So can you
Sure, I can
explain?
talk a little bit about that.
Sure.
So myocarditis, pericarditis. Myocarditis is inflammation of the heart muscle. Pericarditis is inflammation of the covering around the heart, I think is probably the best way to describe it. And certainly we can see that with all sorts of things. With different conditions, we see myocarditis and pericarditis. We actually see these after viral infections in general in young people. It's not uncommon that we see people in the hospital with other viral infections that then develop pericarditis or myocarditis following those infections. And this is something that was described with the mRNA vaccines. That's Pfizer and Moderna. And we first heard about this from the CDC through their surveillance program. Remember, we have a lot of surveillance in place for these vaccines right now with good reason. There's a lot of scrutiny. We want to make sure that they're safe. And so this was brought to light as something that we should look closer at. And so the CDC, ACIP, American Academy of Pediatrics, all of these experts started to look at this and see, is this a concern? And what we've seen is that there are rare cases of inflammation of the heart or the lining around the heart following mRNA vaccines, namely Pfizer and Moderna. And this is more possible to happen in young men ages 16 to about 29 after the second dose. The good news is that it's rare, number one. Number two is that when it occurs, it may cause some chest pain, some discomfort, but typically it goes away without severe effects and people recover completely from it. So it's short-lived. And so they looked at this again to be sure that it wasn't of concern, and they did not see this in the 5 to 11-year-old trial that they looked at. But nonetheless, we know and we talk about it and want to make sure that people understand what it is and are looking for those symptoms and side effects in people that get mRNA vaccines. The other thing that I would want people to understand is that with COVID, we see far greater numbers of myocarditis and pericarditis that can even lead to death, unfortunately, in young people that get COVID. And we've had that happen in our hospital. I've seen cases of that myself. And so we want to be sure that people understand that even though there may be this association with the vaccine and it's rare, that with COVID itself, the risk is much higher for getting myocarditis or pericarditis.
Great. Thanks for taking us through that. Dr. Wayne, you're going to be giving, you obviously as a pediatrician, you give a lot of vaccines in the office. It's also getting to be flu season, so we're going to be doing flu shots. What's the guidance that we've been given with the COVID vaccine in relationship to those other vaccines, timing-wise?
Right. So it's safe to give this COVID-19 vaccine along with other vaccines as well. So your routine DTaP and your flu vaccine, it's fine to give the vaccine along with those. A lot of parents worry that giving different vaccinations at the same time will somehow overwhelm the body's immune system, and that's just not the case. It's safe to give this vaccine and other vaccines together. I have a lot of parents that have concerns about the vaccine being a live virus vaccine as well. They're worried that this is going to somehow give their child COVID-19, and that's not the case either. This is not a live virus vaccine, so it's not going to give your child COVID, and it's safe to give along with other vaccines. And one thing that's also important is that we've had a lot of patients that have fallen behind in their vaccine schedule during the pandemic. In my own practice, I see it that children have not received any vaccine sometimes, since the mid-2020 because of the pandemic. They just haven't been into the clinic. So it's important for them not only to get the COVID-19 vaccine, but also to catch up if they're behind on their other immunizations, and it's safe to do them together.
Yeah, that's a great reminder for parents, because we do know a lot of those shots, a lot of that care has been put off since the pandemic started here back in March of 2020. So definitely time to catch up on some of those shots. Dr. Kimberly, some hesitancy that we see from parents revolves around maybe their child has a medical condition. What kind of guidance should we give those parents about the vaccine?
Yeah, so the important thing to know here is no one is excluded from getting this vaccine. The only real contraindication is a prior severe allergic reaction to this particular vaccine, not necessarily a flu vaccine or another vaccine they would have gotten, so this specific vaccine or one of its components. It's important for parents to understand that children that have underlying medical conditions are at risk for more severe COVID, and that is a reason to get them vaccinated, not to be vaccinated.
Great. I actually had a question come in just to follow up on that. Someone asking about a child that has tuberous sclerosis with a history of seizures and has been seizure-free now for almost 3 years. So obviously the concerned relative is asking, would this vaccine trigger seizures that we know of? Any research on the vaccine causing seizures?
Seizures has not been described as a side effect of the vaccine, and I understand the concern because that is a very serious condition. But again, it would be important to be vaccinated against the complications from COVID, more over the complications from the vaccine.
Great. Okay. Dr. Baumgardt, maybe you could talk to us about, again, some of the things that we heard with the adults when we were talking about vaccines. Some of those side effects, fertility, in kids we're hearing more questions about, is this going to affect puberty? So if you could tell us a little bit about that, what we know.
So in the clinical trials that have been done in children, there's been no effect whatsoever on puberty or fertility. Bottom line, no effect. There's been a lot of information in what I think most of us in the scientific community would call misinformation on social media about fertility and long-term effects of the vaccine on fertility, and that's not been shown either. So there's no effects on fertility that's been demonstrated by data, and it's been looked at multiple times and has been something that's been kind of vetted in the societies that deal with fertility, such as our OBGYN experts, our American Academy of Fertility Specialists, and all of them have looked at this not only in patients, in people that have gotten the vaccines, but in animal models, in test tubes, just to be sure. And they've not found any effect at all on fertility, puberty, or how a child grows. So no effect at all.
Great. Okay. Dr. Wayne, we talked a little bit earlier about some of the side effects. We reviewed some of that. Do you recommend parents pre-treat their child for some of the fever that they might get or the sore arm, that sort of thing?
There's no need to pre-treat with any pain or fever reducer prior to getting the vaccine. In fact, using especially anti-inflammatory medications prior to getting the vaccine might actually decrease the body's antibody response to the vaccine. So there's no need to pre-medicate prior to getting the vaccine, but after getting the vaccine, it's fine to use Tylenol or ibuprofen, other pain and fever reducers to help with soreness at the injection site and things like that.
Great, okay. And the observation time after the vaccine, how long do people need to wait?
The recommendation is about 15 minutes, and that was the recommendation for the 12 to 17-year-old age group as well. And for 5 to 11 years, it's going to be the same recommendation that they, be observed for about 15 minutes after the shot.
Okay, great, great. Dr. Kimberly, what are we doing in this age group under 18? They're minors. Tell us about the process. It's a little bit different for minors than it is for people above the age of 18. So
sure.
Explain that to us.
So with this COVID vaccine, as well as any other vaccinations that we give, we need parental or guardian's consent. And so we have a number of mechanisms to do this. Certainly if the parent comes with the child at the visit, they could do it at the vaccine site, or you could do it electronically through MyChart or the pre-check. We get a lot of questions about the 16, 17-year-olds that can drive, and they're still minors even though they're driving, but so we still need the parental consent for those. Mm-hmm. And so we're asking the parent or the guardian to do that ahead of the visit. And so there's the consent is there for when the driving child arrives for their vaccine.
Great. And generally we want that guardian or a relative to be there, I think, at the time of the vaccination with the child, right?
We do. I think it's moral support, and we started vaccinating yesterday, and there were a lot of brave individuals there, but they got maybe a little bit braver with their parent being there, and so they came with their friends, and it was very cute, but sometimes it needed the parental touch.
Great. Yeah, I saw a lot of them wearing capes and masks and looked pretty impressive. So
Yes.
that's great.
Yes.
So Dr. Baumgardt, take us through some of the safety protocols now with this new vaccine, new age group, and you spoke a little earlier, it's a third the dose of the adult and the teenage one. So what are some of the precautions that Pfizer has taken, that we're taking, to make sure those doses don't get mixed, no confusion there?
So we have taken a lot of preventive measures to make sure that we are giving the proper dose to the proper person, just like we do with any medication, any vaccine that we give. We want to be sure that that person gets the proper dose at the proper time. And the company has made some efforts to also be sure that there's a difference in terms of how these doses look. So the colors of the vaccines in terms of the bottles that they are distributed to us in are different. And we've continued that color coding throughout the process to be sure that the color coding matches those bottles, and so we know which dose goes to which section of kids, whether it's 5 to 11, and then 12 on up is the same dose. So we've taken that in mind. We've done some fun things with our staff in terms of color coding some information, some educational material that matches the color of the vial to be sure that they understand the difference. And we've also taken some measures to make sure that these vaccines stay in kind of separate locations as we're drawing them up and giving them to the people that then administer them. And then our electronic medical record also has some checks and balances in place to be sure that we're double checking that as well in that electronic medical record to be sure that that dose matches. So there's multiple steps that we've taken. That's been something that we've talked about as soon as we knew that the dose would be a little bit different. We've been trying to talk through with our teams, our vaccination teams, our staff. These doses are different. This is how we'll ensure they're different, and these are the safety precautions we need to take to be sure that we get the right dose to the right person.
Great, great, appreciate it. So I know that one of the questions that came across here was about masks, and so we're getting more people vaccinated. With this new authorization, we'll be able to do people from kids from 5 to 11. So I'll add that you notice we don't have masks on. It's probably been since last spring that we were able to talk with you without our masks on, but the mask mandate has come down. The state positivity rate is less than 3% now, which is good. And we've certainly all been vaccinated. But tell us about schools, Dr. Wayne. Maybe you can take this. Question about masking now. Should we continue to have kids mask now that we have a vaccine in this younger age group?
So the CDC's recommendations has been based on the data that they're receiving. And according to the data, the safest approach right now is a multi-layered approach. So vaccination, continued social distancing, wearing masks, especially, if you are having any type of cold symptoms, if you are at risk for spreading droplets to other people, wearing a mask. So, proper quarantining, after exposure, things like that are still important. It's important to take a multi-layered approach to trying to decrease the spread of this pandemic. That's the way we're going to get out of this, is by doing as much as we can to mitigate the spread of the disease.
Great. One of the things that came up when I was talking to someone yesterday was the fact that we have holidays coming up. Mm-hmm. And what happens at holidays, people get together, families get together, children, parents, grandparents, that sort of thing. So maybe Dr. Baumgardt now, after hearing Dr. Wayne, maybe you could talk to us a little bit. He mentioned the layers. Maybe you could talk to us a little bit about that kind of cocooning effect of that families can do to keep everyone safe.
One of my favorite terms,
it
cocooning.
Is.
I know. Well, that term came to be actually with the flu vaccine, and that's where we've talked about it for a long time, because we know that even infants as young as 6 months and below can't get a flu vaccine. So everybody still to remind everybody here today, time for your flu vaccine. It is flu season. Flu season is coming up. We're starting to see flu in some other areas of the U.S. sort of rise, and with masks coming off, unfortunately we'll see flu and other transmissible viruses and those things going up. So the idea, though, is to cocoon the people or the infants or the children that cannot get vaccinated. So for flu, if you have a child that's 6 months and above, get them vaccinated for flu. That's the best way to prevent flu. But for those that are infants, you still want to get everybody around that child vaccinated for flu that's going to have close contact with that child. For COVID, we still can't vaccinate those kids that are up to age 4. So we still need to cocoon them by vaccinating their siblings, vaccinating those household contacts. And what I would say is we know the transmission of COVID is that closer contact with people. So we know in a household, it's more likely that people within those households will get COVID rather than somebody you maybe have a passing contact with in the hallway or on the street. So those close contacts are important to be vaccinated. The other piece of this that I think we always need to talk about is masking in those people that are vulnerable, because we know that there are vaccine breakthroughs, especially in those that are elderly, have other immune conditions. They get vaccinated, they get their boosters, they get additional doses, but still, they may not have as robust of an immune response. So it's important to protect them. And so if you're one of those people that may be immunocompromised, you may have a transplant and be on medicines that suppress your immune system. You may be on chemotherapy for a cancer. Please wear your mask. Please social distance. Please be careful when you're gathering over the holidays. You want to see your friends. You want to see your family. Everybody's traveling now. We know that. Everybody's wanting to get together for these holidays. But please be careful, because we still do know that it's here, that it's not gone. So please protect yourself, especially if you're in one of those vulnerable populations. Again, most important thing, get vaccinated. But if you're vulnerable, additional layers, we know that helps.
Yeah. Dr. Kimberly, maybe you can address, last year we had a surge coming out of the winter, and my concern right now is we've had Halloween, a month later, Thanksgiving, a month later, Christmas and New Year. Again, lots of family get-togethers. What kind of concerns do you have as you think about kind of all this going on and the fact that things are good right now, but they were good before?
Yes, we have been lulled into some false sense of security, and we are concerned with the holidays and the colder weather, people coming indoors, perhaps not as cautious or as diligent about the mask wearing. Again, we understand people want to get with their friends, their families. They want to have these celebrations, but the vulnerable need to protect themselves. And then we know that outdoor gatherings are safer than poorly ventilated indoor gatherings, and sometimes, again, the weather dictates that you have to be inside. But certainly, be mindful. I think it's down to individual risk assessments of your medical problems, what you have, and where your vulnerabilities are. And so just stay safe, because we don't want to have yet a fifth surge. And so we need to get more and more people vaccinated, but to continue to do the things that we know that work.
Great. And I know we've even given some guidance on holiday parties coming up that, like Dr. Kimberly said, outside, much better, much safer. So maybe you can plan an outside party instead of an inside party. So, Dr. Baumgardt, why don't you tell us a little bit about where we can get the vaccine? So parents are out there listening. It's time. We started yesterday. And so where can we go to get those vaccines?
Another exciting milestone is start seeing those 5 to 11-year-olds. And Dr. Kimberly mentioned, it was great to see those kids write the reasons they wanted the vaccine on that chalkboard, on paper. This is why. And we've heard that from teens, from kids. I want to get back to sports. I want to get back to school where I'm not being quarantined, where I'm not having to go to virtual schooling if that's not ideal for that particular child. But we have it readily available. You can go to myochsner.org to schedule an appointment. And then also, if you're not able to do that, the number is 1-844-888-2772. That's 1-844-888-2772, and you can call that number and also schedule to get a vaccination for anybody, but especially now for children ages 5 to 11. We will also have upcoming events, so please keep an eye on that, both on our website and advertisements. We tweet, we send all of these things out for people to see on social media, so please stay tuned for upcoming events. And whatever opportunity you have, please get your child vaccinated, please get yourself vaccinated.
Great. So great news, new ages approved for the Pfizer vaccine. I guess as we begin to wrap up, I want to hear from each of you. We know parents will have questions, there'll be some hesitancy about getting their children vaccinated. We do have approval now for this new vaccine. So what would be your final words, guidance for parents out there as they begin to think through this decision? Dr. Kimberly, you first.
Thank you, Dr. Hart.
Certainly.
I would encourage parents to talk to their pediatricians, ask the questions that they still have. No one necessarily wants to be the first. Some do, but I do hear from a lot of people that they want to wait and maybe get their child vaccinated in a few weeks. And I think it's important to keep in mind of all the things we talked about today, the effect on parents, grandparents, teachers, other children that are immunosuppressed. It's important for all of us to do our part and all of us to be vaccinated. And if you're eligible, we just encouraging people to get vaccinated. But if you still have questions, talk to your pediatrician or your family doctor.
Great. Thank you. Dr. Wayne?
Yeah. As a pediatrician, I wholeheartedly recommend that you get your children vaccinated. Now that it's approved for ages 5 through 11, I think it's just another added layer of protection, not only for your child, but for also other family members. Those, elderly grandparents that, may or may not be vaccinated, may have, comorbid conditions that put them at increased risk. It's another reason going into the holidays to add another layer of protection at those family gatherings. So if now your 5 through 11-year-olds and your 12 through 17-year-olds are all vaccinated, you have a family event where you feel more secure. I have a 7-year-old daughter that I'm excited about getting the vaccine for because it's going to feel much better for us, much more safe for us to have her around her elderly grandparents at this age. She's in school, she's around kids all the time, and gathering for family events is going to feel a little bit more safe to have her there with her elderly grandparents. So I'm excited for it.
Great. Dr. Baumgardt?
So I had an instance this week, actually a couple, and one of it was one of our physicians' child who's 5 just got COVID. And so, of course, is out of school. The rates are low, but it's still there. So that child's out of school. The siblings now are quarantined at home. The family's trying to figure out what to do. They were supposed to go, perhaps out of town this weekend. And so they're trying to figure out all these things that, could have, should have, would have happened. And I know that they would have loved to have that vaccine to prevent this from happening. So, we talk about, and I'm, one of those people that I just don't want another child to die. I don't want another child to end up ill. We have one child in the hospital now with a multi-system inflammatory syndrome following COVID, and that admission was just this week, despite our levels still being low. I'm thrilled that they're low, but we still have these children that are affected. We still have families that are affected. And the best way to get back to not having to deal with that, to getting back to what we call normal, our festivities, our activities, Thanksgiving, Christmas, Jazz Fest, festivals, all the things we love here in the southeastern United States, is to get everybody vaccinated. And so that's our plea. That's why we're here today. We want to make sure that you're comfortable. We answer your questions. We answer your concerns. But the vaccine's effective. It's safe. And why not?
Great. Thank you. We know that you're going to continue to have more questions and some concerns as well. And so if we didn't answer your question today, there's still a lot more answers and information. If you go on ochsner.org/vaccine, there's a lot more information there. Also, just to give you some information again about where you can get that vaccine, if you can go on and call 844-888-2772, or go online at myochsner.org. You can go ahead and find out where the vaccinations are being given and go ahead and get that scheduled. But again, very great news to be able to get this authorization to start giving the vaccines in children down to age 5. So hopefully we've answered some of your questions today. Again, I want to thank Dr. Kimberly, Dr. Wayne, Dr. Baumgardt for your information. I know Dr. Kimberly, you and Dr. Baumgardt have been here frequently, continuing to guide Ochsner, guide our communities through this pandemic. Dr. Wayne, appreciate you coming in and joining us today, because you are you've been, as a pediatrician, been kind of late to the game in the sense of not having the vaccine available, but unfortunately you've been having to see all those children get COVID that didn't have the opportunity to be vaccinated. And now, very happy to see that you're able to offer that for children. So without anything more today, we appreciate you joining us. We'll be doing these again as we have new and more information about COVID, and maybe updates on more vaccines and age groups in the future. So thank you for joining us. Have a great weekend. Call, get those children vaccinated, get yourself vaccinated, and let's keep this state and keep all of our friends, relatives healthy. Thank you very much. Have a great day.